Welcome to Conversations with Daycare Canada. I'm your host, Estelle Paget. The topic of this conversation is the importance of community. And with us in the studio is an absolute leader when it comes to developing and delivering a community of support. And that's Colleen Hobson. Colleen, thank you so much for coming.
Thanks for having me, Estelle.
So in a couple of minutes, I'm going to ask you to share a key message for viewers. But first, I'd love it if they could get to know you a little bit. So what can you tell us about you, the work you do, and maybe even why you do it?
The why, that's a big question. I am currently the executive director of Saanich Neighbourhood Place, which is a family resource centre located in this community. And there's about 10 neighbourhood houses in our community. I have been doing the work that I love for about 20 years. And I'm not sure why. I sort of fell into it when my kids were young, and and then I saw the interactions that were happening between parents, the way they were connecting with each other and being able to support each other. And it really made me see the power that we could have in people's lives and helping to support them to raise really healthy children.
Actually, that's a great lead-in to what your key message is.
Okay.
Yeah, so would you tell us what that is?
Sure. I think for us at Saanich Neighbourhood Place and a lot of the community organizations we deal with, what we would talk about is how important it is for parents to connect with each other, to build up those social support networks. It's not as easy as it used to be when I was a child or when our parents were children. People aren't at home as much anymore, and I think we have to go out and more assertively be building some of those connections. So I think that's the big one. And one of the things that Neighbourhood Places do, our family resource centres, is provide that opportunity for parents to connect with each other. It's difficult being a parent. It's challenging. Our kids, they don't come with manuals telling us how they need to be loved and cared for, and we have to learn it on the job. So having those networks is really important. I think the other one is that we don't have to be perfect as parents, that it's not, that kids, children, babies are all very forgiving, and that we need to learn to forgive ourselves a little bit.
That's lovely. So I've heard you say that support, it's ours to give and it's ours to receive. Mm-hmm. And there's somebody else who talks a lot about support, and that's Dr. Daniel Siegel. He is a psychiatrist based in California, and in a video we did with him called A Community of Support, he speaks about this, and we'll just take a look at that now.
Perfect.
What would be ideal parenting? What would be an ideal way a child is raised? We as a human family evolved to have something called allo-parenting. Allo means other, and parenting is a person who's taking care of a kid. Yet too often in modern life, families are isolated. The quote nuclear family is a cluster together, and there's too much pressure placed on one individual, the mom usually, to raise this child. The child was meant to be raised in a village. You're supposed to have others, older, wiser, stronger individuals who are there to care for this child. And the baby's attachment system in the baby's brain can have more than one attachment figure. And so the idea that it's just the mom, I think, is unhealthy pressure placed on a mom in a scientific view that's inaccurate. And if we don't start teaching this integrated identity of a collective, then the planet's not going to survive. And so everything we do, I think, has got to be with the health, not just of our children and our families and our neighborhoods, but with the larger world in mind. And together as a human family, I think we can turn things around and really learn how to not only serve the world, but to savor the world too.
So, have you any comments about that video?
That was great. I really liked what he said about interactivity between the parents and children. I think that's really key. And the neighborhood-based aspect of it. One of the things we say about neighborhood houses, it's great if they're within pram walking distance of families, so they can build those connections with their neighbors, so that children and, as they get older, youth have all those different safety points in their community.
What are some of the ways that you've put some of the concepts that he talks about, the resources and the ways of getting people to support each other? How have you put that into practice?
I think the big one is that our universal programming. So our program is open to everybody. Anybody with a child under the age of 6, whether they're parents, caregivers, aunts, uncles, we have a lot of grandparents taking care of children, can come and build their own social support network. We try and remove as many barriers as we can. So it's either low cost or no cost. We try and put the times at different times that parents can come. We try and make it accessible to people who speak different languages, because we have a lot of families from different countries that come as well. And we try and provide information. We build it into our programs. We have formal parent education programs that people can attend. We also have a lot of different resources that are just posted around. And one of the biggest places that people get their information is from each other. And I think that's really key. It's experience is such a good teacher.
So you've alluded to this already, that you meet so many different kinds of families.
We do.
Is there such a thing as a typical family today?
You and I have talked about this a little bit, and I'd say no, there isn't anymore. It's the families that we see. We have same-sex parent families. We have very young families. We have parents that have really put in a lot of time in their careers and now in their late 30s, early 40s are having children. We have different generations living together. It's all over the map, and people are having different needs for support, and they're also being able to find connections. One of the things we've learned is that it's best not to have all the same kinds of families together in one room, because if you get a really good mix, people can support each other in different ways, and that's one of the things we found. It's been really helpful for families to talk to parents living in different kinds of situations and just learning from what their experiences have been.
One of the things I've really enjoyed hearing you say when we've spoken about this earlier is that it doesn't matter if it's a single parent, it doesn't matter if it's a two-parent family, it doesn't matter what their socioeconomic level is. Everybody can be a good parent.
Mm-hmm. I think so, and one of the things we also like to say is I think that parents really every parent wants the very best for their child, and it depends on what their capacity is, what they're able to give. And we also like to say that it's a real sign of strength to ask for help, that almost everybody needs help from one time or another. Could be with real basics like having enough food or getting housing on the table. It could be with trying to negotiate step relationships, between step parent and step children, all sorts of different things. But everybody, I believe, wants the very best for their children, and try and make that happen.
You've just mentioned a few of the stressors in today's life. So stress is another issue for today's families. And again, if it's two-parent families and both parents are working, it can be very stressful. If you're on your own with a child, it can be very stressful. And we know that stress is, along with neglect, is probably one of the most harmful things for very young children. So let maybe listen to Dr. Tom Boyce and hear what he says about babies being able to recognize conflict.
Okay.
Babies, like all human beings, come with abilities to detect emotion, to detect the emotions of sadness and anger, as well as the emotions of joy and pleasure. Even during the first year of life, a young child, an infant, can be aware of emotions around conflict, can hear the difference in tone in a voice that is yelling or conflictive, as opposed to a voice that is nurturing and kind. And I would also add that we know that that kind of hearing and that kind of assessment of human interaction doesn't just begin at the time of birth, but actually happens during the prenatal period as well. We know, for example, that babies who have spent the 9 months of gestation in their mother's belly can recognize their mother's voice, as opposed to other voices that he or she may have heard during that period of time in the womb. even during prenatal life, but especially during the first year of life and the first several years of life. Conflict within the family, yelling and anger, is a form of adversity. It's a form of stress that can affect children's well-being. We know that exposure to that and other kinds of adversity can fundamentally change the development of the child's biology, the circuitry in the brain, the areas of the brain that deal with socio-emotional development, can change even the immune system, can change the way that the body's metabolism is regulated. So all of these experiences of what we think of as toxic stress can, over months and years of time, really fundamentally alter the biology of the child and affect that child's vulnerability to illness and mental disorder, often for the remainder of life.
We were talking about conflict and how harmful that can be for young children, and yet how difficult it is to manage. Mm-hmm. Have you any suggestions for parents about what they can do?
Yeah, you're right. There is so much conflict in today's families, or stress as well. I think being really clear about our child's temperament and where they are developmentally can help us to understand how stress can impact them. And so I think those are the key things for that.
Thank you. We're going to move to break, and after that we'll continue this conversation.
A child's early years are foundational for lifelong mental and physical health. Kid Care Canada Society is a charitable organization incorporated in the province of British Columbia. We seek to empower families to raise their children to be socially and emotionally healthy, and ensure families and those who support them have easy access to relevant current research at no cost to the end user. Our appealing videos, now being captioned in various languages, feature world-renowned experts and real families. To access these videos and other free resources, log on to kidcarecanada.org.
Before the break, we were talking about conflict, and you suggested that parents need to recognize that their babies, when they arrive, have their own temperament.
Mm-hmm. They do, yeah.
What are some of the things that parents typically expect when they're expecting?
I think in terms of temperament, you mean? Or yeah.
About how they're going to be as parents.
Okay. I think that there's often a little bit of a mistaken belief that everything's going to be rosy, and that actually when the baby comes, it can actually be really challenging in terms of lack of sleep, the stress between partners, just having to negotiate that, the disagreements that might come up, or the expectations. I think those people have high expectations of what it's going to be like, and then reality sits in.
Well, some parents like to foresee their child's entire path, right? Which sports they're going to play, what schools they will go to.
Yeah,
yes.
Yeah. And if children, often our children come with a different temperament than our own. So if, for example, a parent is very outgoing and wanting to be with people all the time, and they are blessed with a child who's more of an introvert, that can cause some real conflict between the parent and the child as well. And I think understanding that we don't all have the same temperament is really helps parents to understand how to nurture their child's development.
You've talked about recognizing your child's temperament. Mm-hmm. You've said we don't have to be perfect as parents. This is all very helpful. And you've talked a little bit about some of the programs that you offer. What is there that's available for children when they're around 2 or 3 years of age?
Well, I think there is, so for in Greater Victoria, we have a lot of different programs. We're so blessed here with the number of services that we have. Our public libraries have wonderful preschool age programs. There's a lot of private and nonprofit preschools and childcare centers, and all of our neighborhood houses have parent-taught drop-ins, as well as the recreation centers all have a lot of registered kinds of programs around tiny tutus, those kinds of things. So there's a lot of opportunity for parents and children.
Some parents are concerned about putting their children into a program when they're only 2 or 3 years of age, and yet we know from a lot of research that actually there are advantages for all children, and Dr. Tom Boyce speaks about this very well in a very short clip that we're going to look at now.
Okay.
The evidence from child development research is pretty clear. The earlier a child begins to experience intensive and sustained learning, the better off that child is going to be in terms of educational attainment for the rest of childhood and adolescence, in terms of the development of intellectual and cognitive ability. And we've talked about how children begin learning even in the first few months and years of life within their family. It's a learning environment that they experience. So it is certainly all to the good for children as early as 2 or 3 to come into a preschool environment and to begin to learn both cognitive skills, colors, sometimes the ability to have basic reading skills established. Importantly, beginning to learn how to interact with peers of their same age and understanding how social relationships work. So the evidence is certainly that children from all socioeconomic walks of life benefit from early education that begins to happen in the family in the first few years of life, but then can begin to happen and flourish even more in the preschool years and on into primary school.
Tom Boyce talks about this value for all children to be able to have some kind of a formal setting. What do you think? Is that something you offer?
It is, yeah. I think it's really important. We at Saanich Neighbourhood Place have just created a preschool program that we have been running now. We're going into our 4th year. It's and what I see for parents and children is that I think that routine, getting to know a routine, and also the separation from mom or dad or whoever the primary caregiver is really important. That's an important developmental milestone for kids. I see, and Dr. Boyce mentioned it as well, the idea of the social interactions and learning to get along, learning to share, learning to make friends, learning empathy. All those pieces are so key. We put much less emphasis on sort of the reading and writing. There's some of those basic skills, learning how to hold scissors and that sort of thing, but it's more the social emotional piece that we think is really strengthened by early any kind of childcare opportunities that parents have. I think it's a really good opportunity for parents and plus it gives parents a break, which they may need. Yeah.
So 2 things come to mind from what you've just said. One is the separation and the value that has for children. And the other is that many families today need to put their children into daycare. And so many have concerns about that. Children do get sick. They pick up all these different germs. But there's value for the children.
Absolutely. I see that. It also provides children with a lot of consistency. One of the things that we're often seeing is that parents are having to make do with childcare arrangements. So the childcare there's not a lot, it's expensive, and this is, as you know, an expensive city to live in. So they're meshing together different childcare opportunities. So they might be with grandma a couple of days a week, another childcare center a couple of days a week, and some of that, it adds stress to families' lives as well, but it's what families are having to do to make things work. Yeah.
We've talked about stress and we've talked about how it can be harmful. But another thing which is very interesting about stress is a little bit is actually very good for children. When you mention the separation between parent and child, the last person we're going to hear from today is Dr. Carolyn Steinberg. She's a psychiatrist who specializes with in working with families who have children from 0 to 5. And one of the things she talks about is that children do need to have that separation from parents and little bits of stress, manageable stress, so that they can become resilient.
Yes.
Yeah. The other thing that, she talks about many things, but she also talks about the value in having a strong attachment relationship for a child and some consistency over the first couple of years of life.
I think that can really, having that strong attachment can really mitigate stress for young children.
And it was interesting to hear that children do well by having a strong attachment with more than one person. Some parents are a little nervous if they see that their child is strongly attached to a different adult, but in fact, that's what benefits the child and gives them a sense of security.
And a sense of community.
Yeah. Security reminds me of one thing we're going to mention just before we go to our last video, and that is, just like us, all adults, we like to feel safe and secure in our relationships. And for children, it's critical, especially during the early months and the early years of life. If they don't have that sense of security, their brain can't really develop in a healthy way. Let's hear what Dr. Carolyn Steinberg has to say about support and the importance of community.
I know there's a trite old phrase about it takes a village to raise a child, but I do firmly believe that a family and a community need to provide an envelope of services around a newborn baby so that the family can do the best job they can raising this infant and we have a functional member of our society.
She says what you say.
Excellent.
The importance of community.
Yeah, yeah.
Are there final comments that you would like to make?
I guess one of the things I would want parents to know is just revisiting the idea, excuse me, that parents don't have to be perfect. We can't be perfect. In fact, one of the parenting programs we do is called Nobody's Perfect, and not having that expectation. I caution parents with social media just to be careful and not to have too high of expectations for themselves and their family.
Well, you've mentioned that young parents today who are online a lot are often overwhelmed by the number of resources. How do they choose?
I think how they choose is by talking to other parents. So we're back full circle to connecting with other families and finding out what works for them. Yeah, it's really, there's so much information now. We used to have a parent resource library, but we don't have that anymore because nobody was borrowing books or videos because they go online and access information. So KidCare Canada, for example, with all of its reliable research is a great place for us to suggest for parents to go.
It's hard to know what's trustworthy. We recommend also the Ministry of Health, obviously, the Canadian Pediatric Association, Neighbourhood houses.
Yes, absolutely.
Before we close, there's one thing I forgot to ask you, which I really wanted you to talk about, and that is, what is an early years centre?
Okay, so an early years centre is an initiative of the provincial government through the Provincial Office of the Early Years, and they are around the province. There's 47 of them. They are all reflective of their own communities and the needs of their communities, but what they all try and do is to increase accessibility for parents to services for their young children. So in our community, because we have a lot of services in Victoria, a number of what we're going to be working towards is coordinating them, creating a one-stop shop. So parents can come, they can have access to childcare, parenting programs, parenting support, and opportunities to meet with other parents as well. In other communities, it'll look a little bit more like direct service, but it's a way for us to also really emphasize the idea that it's important for parents to spend time in the early years.
We've come back to support. I want to thank you for the support you've provided today for so many families. Thank you for coming.
Thank you.
Thank you for joining us for Conversations with KidCare Canada. We hope you will check out the website where you will find full-length videos, many of which are translated into 11 languages. Follow us on Twitter, like us on Facebook, and please remember, we're here to support you on your journey as a parent.